I'm losing my mind just a little.
This is the coolest children's urgent care ever. We're in the sea turtle room. Hey guys, so I'm here with Brooke at urgent care. She has an ear infection from last week and is on amoxicillin. And she has been on her antibiotics for 8 days now, and she has a fever, a headache, ear hurts, and her throat is still hurting her. She's sleeping now. It's 8:30 at night. And they just swabbed her for strep, and then the doctor's gonna come in and I'm sure check her ear because I don't think her ear infection's gotten. Feel so bad for her. I wish I could take all the pain. Hey guys, so today is the next day. I know I started this vlog with me at the urgent care with Brooke, and she seemed like really sick and everything, and she is really sick. So I wanted to kind of give you guys a little like update on my kids' health, because both Brooke and Blake have been seen at urgent care or the emergency room within the last week. And actually we found out they both need surgery. So what first happened was Blake had started throwing up about a week and a half ago, and I didn't think anything of it. We just thought that he had like a stomach bug. So my husband stayed home with him while I was at clinical and got him the proper medicine and stuff. So that was on a Wednesday, and then that Friday I noticed that he had an enlarged side, the right side of his scrotum, where his right testicle is, was really enlarged, and I noticed this in the shower. And so I called the doctor, and they thought that it could be a testicular torsion, where like the testicle twists on itself and cuts off blood supply. But then they also said that it could possibly be a hernia, so they sent us to the urgent care for them to evaluate him before sending us to Children's Hospital. And so when we got to urgent care, they determined it is an inguinal hernia, where his small bowel is actually pushing through into his scrotum. And they said that this could be because he threw up so violently and forced it through, or he could have just had like a hole that never sealed between his scrotum and abdomen, where it just happened to slip through, because sometimes like in boys it doesn't close right away, and obviously he's only 3. So after that, about like 5 days later, we got him in to see a surgeon, and his surgery date for his inguinal hernia repair is February 27th at 7 a.m. So that's what's going on with Blake. Then with Brooke, so about 2 days after Blake was in urgent care, Brooke spiked a fever of like 103. She was crying that her ear hurt. She was crying that her right side hurt, and of course, the doctor thought it was appendicitis. Well, they sent her to Oishei's Children's Hospital here in Buffalo, and they determined that it's not the appendix. We were there for like 11 hours, but it was not the appendix. Luckily, it was like, I don't know if this is luckily, but there's like a small tear or strain in her abdominal muscle on the right side. But other than that, they found out she had a severe ear infection, so they put her on amoxicillin. That was about 9 days ago. Then last night, Brooke had a severe headache, a fever, and was just saying that her whole head hurt and that her throat was hurting. So now I'm like, now what's going on? Because I didn't expect her to be sick after being on antibiotics for 8 days. Well, long story short, we go to urgent care, and as you guys saw, she was extremely sick. She had a fever. They swabbed her for strep, and it came back positive. Her ear infection is still there in the right ear, and now she has an ear infection in the left ear. And she has a sinus infection on the right side now. So, because of all of this, they moved her antibiotics from amoxicillin to Augmentin, which is, I guess, a lot stronger. And they said that, like, it's time for her to go to an ENT, an ear, nose, and throat doctor, and get the tubes and tonsils and adenoids out. So in the last 2 years, so Brooke's in first grade, since the beginning of kindergarten, Brooke has had, I think now it's 16 ear infections. And then since the beginning of kindergarten, she's had strep 9 times. And she has been on so many antibiotics that the doctor is just saying, like, it's not good for her system. She's built up a resistance to amoxicillin, and she just needs to be treated with the whole trifecta of the tubes, tonsils, and adenoids to prevent more ear infections and more strep throat so that we don't keep giving her Augmentum and ruining her immune system even more. Today is the 22nd, so Blake's surgery is in 5 days. He'll have like a 3-day recovery at home. It's an in and out surgery, so we'll go there. He'll get seen at 7 a.m., hopefully, get in for surgery, and then come home the same day, and then he'll recover at home for 3 days. After that, I'm scheduling Brooke's surgery and her appointment with the ENT to get all her stuff in so that we don't have to deal with the amoxicillin and Augmentum situations and strep and all of that again. So that is my little update on my kids' health. It's been like stressful, scary, exhausting, but at the end of the day, the two things that are going on with my kids are very like fixable. They're common, and that's good. Like, I didn't want a testicular torsion because that is very severe, and he could have lost a testicle. So an inguinal hernia is very repairable and manageable, and he's not like in a ton of pain. He's gone like a week or two now with it, waiting for surgery, so I'm glad he's doing good. And then same with Brooke. Brooke is not, I'm happy it wasn't appendicitis and she wasn't rushed into emergency surgery. I'm happy that it's something that we can fix fairly easily, and that both surgeries are very common, very easy, in and out on the same day, and their recovery shouldn't be too bad. So I'm thankful, but at the same time, I'm exhausted, and it's just what it is. I just wanted to give you guys a little update on how my kids are doing. So please give this video a thumbs up and subscribe so you don't miss more updates on my kids. I'm going to try and vlog some of Blake's surgery and whatever I can for his recovery. It's going to be a long couple weeks, especially with me still being in college, but we'll get through it. I mean, that's all you can do as a mom, is just kind of like, or as a parent in general, because my husband and I together are just, we're exhausted, but you got to get through it. So thank you guys so much for watching, and I will see you guys next time. Bye, guys.
Why don't you just meet me in the middle? I'm losing my mind just a little.